In every stage of life, a woman has the opportunity to make important decisions that can maximize her health and prolong her life. At the Washington Women's Center, we have the in-depth knowledge and breadth of experience in all facets of women's health care. We're committed to helping women get started on and to continue on the path to good health by helping them make healthy decisions along the way and by showing the way to achieving balance and wellness. This series of women's health programs is designed to offer women of all stages of life the information they need to live a healthy life.
It's good to see all of you here. My name is Kathy Hesser, and I'm the Women's Center Coordinator. And it's my job to not only bring you classes that are focused on women's health, but also to bring you programs around exercise, around breast cancer. And so I welcome all of you here today. This is a subject that a lot of women always ask me to present, and I'm happy that Dr. Saleh could be here today to present on the topic of urinary frequency. So sorry, gotta run. Yes, I feel that way myself sometimes. And so our main goal with all of our programs here is to give you something that you can learn and actually take away and use. So I'm hoping that we reach that goal today. I'd like to introduce our speaker. Dr. Mark Saleh is a Canadian. When I was first a nurse, I worked with a lot of Canadian orthopedic surgeons. Oh, so I always love our Canadian doctors. He is a diplomat, board certified by the American Board of Urology, and he is with our Washington Township Medical Group, and he's here today again to talk about urinary frequency or overactive bladder treatment and diagnosis and treatment. And then we also have our physical therapist who will be talking for a little bit afterwards on exercises that you can utilize. So again, welcome Dr. Saleh.
Thank you very much. And thank you everyone for coming today. I hope you'll enjoy this. So it looks like I have to stand back here, so I hope you don't find that too impersonal. So we're going to be talking about overactive bladder. Bottom, what that's supposed to say, the main thing is that urgency is the main symptom that you need to define what we call an overactive bladder. And urgency is the sudden, uncontrollable urge to void. It comes with very little warning. Sometimes it's associated with bladder leakage, and sometimes it's not. But if you have sudden urgency when you don't have a full bladder, that's basically the definition of an overactive bladder. You have an overactive bladder. Now, often that also comes with frequency, voiding more than 8 times a day. It comes with nocturia, or getting up at night, and it may or may not be associated with leakage. So if you have urge incontinence, if you have a sudden sense of urgency and you can't hold the bladder and you leak, that's called urge incontinence, and that's what we call a wet version of the overactive bladder. Now, you could have the dry version where you just have the urgency and you're always running to the bathroom, which is not as bad, but still very bothersome for most patients. This is a diagram of the female pelvis. I'm going to come around here. This is the bladder sitting in the pelvis. This is the urethra where the urine comes out from. The vagina is right there, the uterus, and the rectum. And this is the pubic bone. With childbirth and with relaxation of the muscles that help support the bladder, you may have what's called a cystocele, where the bladder falls down through the vagina, and you might see a bulge down here. That often causes what's called stress incontinence, where when you cough or sneeze and the pressure inside the abdomen goes up, it pushes on the bladder and causes the urethra to open up uncontrollably, and then you have a little bit of a squirt of urine. That's a different type of problem. The stress incontinence and the urge incontinence and the overactive bladder sometimes go hand in hand, but they are separate problems that are treated differently. If you have pelvic relaxation and you have stress incontinence, you could do Kegel exercises to help strengthen the muscles of the pelvic floor and to close off the urethra here and to prevent the stress incontinence. If it's more severe, you might need a surgery to lift the bladder up or put a sling underneath the bladder. That's a procedure that we could do in about 15 minutes as an outpatient. That works really well for the leakage. But let's go on with the overactive bladder. Here's a question for the audience. What do you think is a normal bladder capacity? What should a bladder hold? 250 milliliters is about 1 cup. Any guesses?
300, 500.
That's right. Very good. That's the answer. So there are variations, of course. Some people have a small bladder and have about 1 cup or less for capacity, and that's part of their problem. And they might be born that way, or they may have had some sort of condition that affects their bladder. Chronic inflammation, infections, major surgery on the bladder, radiation to the pelvis can all sometimes cause the bladder to become contracted and small, and that can lead to urinary frequency because the bladder just simply can't hold very much. So what is a normal amount of voids per day? What do you consider to be frequency? What would be a normal number of times that you should go to the bathroom? Any ideas?
4 to 6 times.
Yeah, it seems like C is always a good one, isn't it? Or 2. We don't consider somebody to have urinary frequency until they go 8 times a day or more. Now, of course, it's very variable, and if your normal is 2 to 3 times a day and you're going 5 or 6, that's probably too much for you. But on average, 8 times or more is considered urinary frequency. No, it's okay. We can describe it. Basically, we looked at the diagram of the female pelvis in general. This is a close-up of the bladder. So this is the bladder. This is the urethra, where the urine comes out. And these muscles here is the pelvic floor and the external sphincter that helps you control the urination. As the bladder fills up, when it gets to about half of the capacity, so roughly 250 to 300 milliliters, that's when most people get an urge to void. But you should still be able to hold it. When that happens, the bladder gives you a minor contraction that gives your brain the idea that you have to go. You make your way to the bathroom, and contractions, a medication called, or actually a neurotransmitter called acetylcholine is released by the nerves that causes the bladder muscles to contract. And that's what a bladder contraction is, and that's what causes voiding. In an overactive bladder, we think that reflex, that the acetylcholine is being released too much, or that the bladder muscle is too sensitive to that chemical, so that the bladder contracts sooner than it should. Before it gets to capacity, when you only have 100 milliliters, maybe half a cup or less, you get the urge to go. So you go, you only void a small amount, the bladder fills up again to that small volume, and you have to go again, and the cycle continues. And the way to deal with that is to block that transmission, to kind of minimize the nerve action on the muscle. And we'll talk about the medication that does that later. So when do you need to be concerned about an overactive bladder? When is it not just an overactive bladder? If you don't have any other symptoms associated with it, then that's probably all it is. And you can just see your doctor, and they can start you on a medication called an anticholinergic medication. If you have any of these symptoms, then you really probably should see a specialist and should be evaluated further. If there's any blood in the urine, that's never normal. Microscopic blood that the doctor tells you about, or whether you can actually see visible blood, is even worse. You should always be evaluated by a urologist with x-rays, a cystoscopy. Pain or burning is not normal. That might be a sign of a bladder stone or infection. If you have a pelvic mass that the doctor discovers on examination, if you've had radical pelvic surgery for, say, a hysterectomy for cancer, if you've had radiation therapy, all those are indications that it may be not just a run-of-the-mill overactive bladder. Suspected fistula, if you're leaking constantly, and if you've had pelvic surgery, you may have what's called a fistula, which is an abnormal communication between the bladder and the vagina, or to another part of the body, where the urine is leaking from an abnormal opening. And that would require repeat surgery. We won't worry about the men today. They'll have their own talk. So why is this a big deal? What's the burden of an overactive bladder? A very large number of people in the United States have symptoms of overactive bladder that may be undiagnosed or untreated. We think at least 33 million people are involved, and that includes men and women and people of all ages. And the prevalence does increase with age, as you might expect, because of various associated medical conditions. So this just gives you an idea about that first of all, the blue bars are men, the white bars are women, And this is as you increase in age, these are age groups 18 to 24, and up here it's 75 and plus. The prevalence or percentage of people that have it increases as you would expect. Most people that have overactive bladder have what's called the dry overactive bladder, where they can hold the urine long enough to make it to the bathroom. About a third of them, 37%, have the wet version. That's urgency with urge incontinence, where they get the sudden urge with very little warning, the bladder contracts even more, and they leak urine, which can be sometimes a lot more than just a little bit of a squeeze.